Brian Mudd Show is on News Radio 610 WIOD.
We're joined once again by Dr. Jason West, and one of the latest dynamics in play with COVID-19 for people who have had the virus is this complaint about brain fog. I think that's something that we all can relate to. If I have to wander into a day without at least a couple cups of coffee, I don't think it ever leaves me. So a lot of us can appreciate what it's like to just not quite ever feel like we're getting going mentally. But this is a much bigger problem if it's persistent. The question becomes, is this a side effect, a long-term side effect of COVID? So Dr. West, tell us a little bit about what we're hearing regarding this condition and what we might be mindful of.
Well, Brian, thanks for having me back, first of all. And then the second thing I have to chuckle about is we had our coffee maker go down here in my office, and I was told, look, under no uncertain terms can you allow this to happen. This is a crisis emergency. Fix it now.
Yes.
And then the next thing that I'd say, I've told my wife, I don't really care about gray hair and wrinkles. Like, I'm trying to age as slowly and gracefully as possible. But neurologic stuff, brain fog, forgetfulness, inability to recall words is so concerning. And I've had more patients coming in saying, look, I had coronavirus this summer, or I had it in September or October, and I just feel off. And my ability to have mental stamina and recall seems to be affected. And so I think you're going to see more and more of this.
Well, and so I appreciate the coffee maker as an essential piece of equipment in your doctor's office. That's one. But if you have people who have had their coffee and they still can't get it going after COVID, that is notable. So in your practice, in your experience, you are witnessing what we are hearing could be a long-term side effect.
Well, again, we hope it's not. And again, the last 10 months feels like 10 years, but really it hasn't really been that long. We don't know exactly what the long-term ramifications. But there is a study from the British Journal of Medical Practitioners that came out in 2009 that says that chronic viral infections, and they were talking about Epstein-Barr and cytomegalovirus and the rhinovirus, which causes the runny noses and stuff like that, that one of the problems with certain segments of the population that aren't healthy, it causes neural behavior. So your nerves aren't behaving right. Neurodegenerative, they're breaking down. Psychiatric, it's making your brain and emotions and anxiety, depression. It can mimic autoimmune and fatiguing illness. So the journal article is chronic viral infections cause neurodegenerative, neurobehavior, psychiatric, autoimmune, and fatiguing illness. Fast forward 10 years, we've had this unusual virus that's coming through, and for certain people, it's just really upsetting their nervous system.
Well, and Dr. West, you're the doctor, but what I hear you say is concerning to me as just someone who has periphery knowledge. But generally, when we're talking about neurological damage, that is not easily undone. In many cases, isn't undone. It doesn't necessarily heal itself the way the rest of the body does. So if we're talking about that type of condition, could this be a permanent impairment?
Well, it's possible that it can be an impairment. I do want to put some silver lining in the cloud over there. Now, the nervous system takes longer to heal, but there's some really neat things that we can do that I'm seeing some good clinical improvement. And again, I have to make the disclaimer, this hasn't been evaluated by the FDA and the other things. It's just Mrs. Smith and Mr. Anderson in front of me when we are telling them, look, let's really amp up your essential fatty acids. So omega-3s, omega-6s, omega-9s, your small, medium, and long-chain branched fatty acids. We know it helps cardiovascular health, but if you think of how this works, it helps to protect the cell membrane or the phospholipid bilayer around the cells. It also helps to lubricate the body. It helps the blood to spread out so that it's not sticky. And then the next thing is it really helps to protect the myelin sheath in the brain. And the standard American diet, we're just really deficient in healthy fats. We get a lot of bad fats, Crisco and margarine and saturated fatty acids. But if we are functioning on avocados and coconut oil, and if you're not dairy sensitive, butter, chicken noodle soup, beef stew, that can really help your neurologic function and help protect your brain.
That's really good information. In some cases, tasty information as well. So I approve of that medical advice. In your experience, when we're talking about a new dynamic, whether it's a virus or some other element that causes a condition, how long do we need before we have conclusively information about what is a long-term side effect versus what might just be, the temporary issues that could go away?
Well, when we talk about long-term versus temporary, that's relative, because I had one patient that said, hey, I got coronavirus the end of October, and man, I just don't feel sharp. They weren't like hospital sick. They didn't need a respirator. But they're saying I'm still, and they said it feels like eternity. And in my mind, I'm like, wow, it's only 90 days. That's not very long. But I'm not the one that's experiencing that. And so when you talk about looking into the crystal ball and saying, hey, predict the future, predict what is going to be the effect of someone that's had the coronavirus that doesn't feel normal, that's struggling with word recall and with memory. And the answer is well, time. But then the other half of me says, look, here is the opportunity now to really do some things that we know can have some positive effects, which is making sure we get those essential fatty acids in to protect the nervous system. And then the other part of that is we got to make sure that the digestive system and that the liver and the gallbladder is breaking down and emulsifying the fat so that you can use those. So many times people are putting fats in their system, and then because their liver's gummed up, they're not able to use them as effectively. It's a two-part system. Put the essential fatty acids in your system, and then hopefully it's breaking down and using it. But I think there's a lot of positivity that you can really make a difference and help people that are having brain fog by just getting the right fats in their system.
This is really helpful information, and I certainly do appreciate it. And I certainly wish you well with your coffee maker because, before we start talking about putting healthy, fats and acids in our body, you got to put the caffeine in. That's where it all begins.
Well, my assistant told me, look, if you want mutiny here, like there are 9 people are walking out of the office and let you go get that Keurig fixed, and you go get it fixed now, or bad things are going to happen. So, I was told they're willing to put up with a lot, but a broken coffee maker is not one of them.
I'm with them. All right. Dr. West, thank you very much. Always a pleasure.
Thanks, Brian. See you later.